Southern California EMS Training Institute. Today we're going to be talking about suctioning and how to appropriately remove liquids and maybe vomit or other nasty things from your patient's airway. So when we're suctioning, we need our portable suction unit. We should make sure our portable suction unit is all checked out. Make sure that it's charged, all right, and has full of battery. A couple other things we want to make sure we do. We have a good clean suction canister on here, as well as that all these holes up here are plugged. We should have one hole that actually goes to your suction unit, and then we should also have another hole that actually goes to your patient, so your suction tubing actually hooks up. All these other holes should be plugged up to make sure that we get good suction when we're using this device. Now we have two different suction catheters. We actually have this one, which is called a rigid tip or tonsil tip, and also known as a Yonker. Right, and we have this one, which is also known as our soft tip, right, or our French tip catheter. Now the soft tip or French tip catheter is really good anytime you're suctioning a patient's nose or suctioning a patient's stoma or tracheostomy tube. So if they've got a little hole in their neck, this is a good one to go ahead and use for that. So we're going to show you guys how to suction with our with our soft tip catheter first, and how to suction a patient's nose. So we go ahead, we hook up our suction tip to our suction tubing, and I'm going to go ahead and make sure I turn my suction unit on here in just a second. The other thing I want to do is I want to make sure that I size it before I insert it into my patient's nose. Now I should size it from my patient's earlobe, right, all the way to the tip of their nose, and if you see here, that looks to be right about the correct size. Now, a couple tips when we're going in and we're suctioning that. One is we should only try and suction on the way out. Two, all right, we shouldn't suction any longer than 15 seconds for an adult, or 5 seconds for a child, or 5 seconds for an infant. Again, if we do suction for 15 seconds for an adult, we should follow it up with 2 minutes of oxygenation. Same thing, if we suction for 5 seconds for a child, we should follow it up with 2 minutes of oxygen. Now, when we're using this, you guys, we're going to go ahead and flip our suction unit on. We're going to insert it no further than measured, and suction all the way on the way out. Again, no longer than 15 seconds for our adult patients. Now, if we're going to suction our patient's oropharynx, or the mouth, we use our Yonker tip, which just kind of helps get those bigger chunks, larger chunks out of the mouth. It's just better for the mouth. We need to size it and fit it appropriately. Right, so we go ahead and we size it from the patient's earlobe to the corner of their mouth, and we're not going to insert it in any further than that. We also, when we put it in, you guys, only suction for 15 seconds, only on the way out for an adult patient. Again, for a child or an infant, only 5 seconds. Now when we insert this, right, go ahead and insert all the way to the back of their throat, right? Apply your suction. The way we apply our suction is by plugging up the little hole we have here, right? Once we plug that up with our thumb or our finger, we're going to go ahead and allow suction, and this vomit or whatever will be in their mouth will get suctioned out. So we insert it in all the way to the back of their mouth, no further than we saw. Suction no longer than 15 seconds for an adult patient. All right, only on the way out, trying to do these little circular motions as we apply suction. After 15 seconds of suction, we should take this out, and we should go ahead and oxygenate our patient for at least 2 minutes. Now what we can see is that when we're using our suction unit, right, when we apply our suction, we should see, and we plug this hole, right, we should allow suction, so we should see this tube fill up. And this is going to dump all of this nasty stuff into our patient's suction canister. So I'm going to go ahead, flip on my suction unit, and I'm going to apply suction for no longer than 15 seconds. After my 15 seconds, hopefully I've suctioned out enough liquid or vomit from my patient's airway that now my patient has an open or at least clear airway for us to continue to manage. This is Southern California EMS Training Institute on how to appropriately use suction equipment. I hope that helped. Thank you guys very much.